Hi, Bonnie. How are you doing today?
I'm doing good.
Good. I'm Josh. I'm a doctoral student of physical therapy under the direction of Dr. Clausen. Coming in for some chronic low back pain, is that correct? Awesome. So we want to take care of that for you today. Just wanted to talk to you a little bit about that pain that you're having. So because this has been a chronic problem that started back from your pregnancy 2 years ago, we believe that problem is now in the maturation phase of healing, meaning that your body's gone through the inflammation and the swelling and it's laid down new cells that are there, and we just need to figure out how to make the cells that are already down there not be in pain anymore. Does that make any sense to you, or do you have any questions about what stage you're at? It's the latest stage of healing there.
Okay.
So what we're going to do is we're going to do some therapeutic ultrasound, similar to what you had when they were imaging your children. Same wavelength. Basically what we do is we send an electrical impulse in through our ultrasound machine through a crystal that's in the head here, and it's going to create that electrical impulse to a mechanical sound wave. And then that's going to stimulate the cells in your back to warm them and to help us to increase their elasticity and how well we can move those cells. Does that make sense?
Yeah, I follow.
Okay. Do you have any questions about ultrasound or anything like that?
Are you gonna get a picture of my lower back?
So we don't pick up the signals as they come back in, like they would do when they're imaging a baby, but it's just the same wavelength basically that we're using, the same type of wave.
Okay.
So it will get a little bit warm. I will have to touch your lower back. You're not pregnant right now, correct? That would be a contraindication, something we wouldn't want to do ultrasound this way for. And do you have pretty good sensation of your back there? Okay. I am going to need to access the painful spot there on your lower back. So if you could untuck that shirt, lay down for me, if you're comfortable with that. And then I will also touch that part just to make sure that we have good sensation.
Okay.
Does that work?
Yeah.
Okay. I'm going to come up here, I'm going to bring your shirt up just a little bit, perfect. And then I'm also going to tuck a towel into your waistband just so that I don't get any of the ultrasound gel on your pants.
Okay.
Are you comfortable there, Bonnie?
Yeah.
Do you want anything for your feet, or are you good there?
This is okay.
Okay, sounds good. All right, so I am going to come over here to the ultrasound machine. And because Bonnie's problem is deep in her back, I'm going to set the frequency here first to ultrasound. I'm going to do 1 megahertz, and since I'm going for a warming sensation, I'm going to have 100% duty cycle, and then I'm going to up our treatment time to about 7 minutes because it is a little bit larger of an area, and then I am going to, once we get going, up our intensity to about 1.5. So, Bonnie, we're going to come here and we're going to apply a little bit of gel on that lower back. Sorry, it's a little bit cold. And then I'm going to start this head moving here. Just click start and up that intensity to 1.5. All right, Bonnie, as we're doing this, you may feel those tissues becoming a little bit warm. That's from the ultrasound, that's what we're going for here. But you shouldn't have any pain or any sharp feelings or pinching or burning sensation, okay? So if it does feel that way, please let me know and we will adjust the treatment. Okay. The ultrasound machine has an effective radiating head, which is about the size of the head of the ultrasound wand. I'm treating an area just 2 to 3 times that size, so that we can effectively warm Bonnie's lower back tissues here. If we were to increase our treatment size, we would want to up the time so that we can effectively heat the tissues there. And as if this were our 7 minutes, we would come over, we would stop the machine, and then we would take the wand from the patient. Bonnie, was everything comfortable as we were doing that treatment?
Super nice.
Awesome. Glad to hear that. Let me help you clean up this gel here. And then you'll be all set. Thank you for coming in today, Bonnie.
Thanks, Josh.